Unsightly and often painful, varicose veins are often dismissed as, well, more just a cosmetic problem. In fact, though, they can be a sign of more serious circulation problems. 1 in 5 people in the United Kingdom is affected, slightly more men than women, and more than 100,000 varicose vein operations are carried out on the NHS every year. However, varicose veins are the most common operation carried out in the private sector, with more people opting to pay rather than opting to hang around on long waiting lists. A new treatment imported from Silicon Valley in California looks set to revolutionise the way varicose veins are treated, but at a cost, and not everyone is convinced. Mairead Devlin has been looking at the new developments.
Varicose veins occur when valves, usually in the leg, are unable to keep the blood flowing upwards towards the heart. When that happens and blood starts to flow backwards, it gathers in the veins, forcing them to bulge out. Sarah Simpson from Guildford says the result is agonising.
My varicose veins started when I was 22, after I'd just given birth to my first child. They're extremely bulbous, and at the age of 22 it's quite sad to think that you have to cover yourself up and not be able to go and show your legs off in the summer. They do ache constantly from the minute you wake up in the morning, and obviously extremely unsightly.
Consultant vascular surgeon Mark Whiteley says the treatment has barely changed in the last 50 years.
The usual treatment for this is an operation called a high tie and strip, which is quite a painful operation. It's usually done under a general anaesthetic, and it's a cut in the groin and then a stripping out of the vein to the below knee position. Then the veins below the knee are pulled out through very small little holes. Most people take 2 to 4 weeks off work and have a lot of bruising and find it very difficult to drive and get on with normal life after that operation.
I underwent the operation to strip varicose veins from my legs 5 years ago. Woke up to excruciating pain, actually, where they cut you at the groin. My husband had to have 2 weeks off work because I certainly couldn't deal with the children. I had to have 3.5 weeks off work, and even when I did return to work, they were still extremely painful.
But Mark Whiteley, who's based in Surrey, is pioneering a new treatment from America, which he claims is much less painful and more effective.
It's a catheter-based system, which basically means the whole thing is done through a single pinprick at the ankle. A long, thin catheter is then passed up the vein, up into the pelvis. It's all done under a general anaesthetic, so the patient's still asleep. And then we use an ultrasound machine to make sure the catheter is in exactly the right place. And then we start passing radiofrequency current into the vein wall, which heats it up and destroys it. This means that there's no cut in the groin, there's no strip at all, and the vein is completely closed. There's almost no pain at all, and almost all our patients are back to work within 24 to 48 hours.
Sarah Simpson had the new operation 6 weeks ago. She's delighted with the results.
This time round I went in on the Friday lunchtime, had the operation 5 o'clock in the afternoon, woke up to no pain, just tenderness on my legs, no bandages, went home at 11 o'clock Saturday morning, and pretty much by Sunday I was back to normal. I returned to work after 3 days. Once I'd soaked the steri strips off 2 days later, I was just left with freckle-like marks over my legs, which are already disappearing, and obviously no scars.
Surgeon Jonathan Earnshaw from the Vascular Society of Great Britain and Ireland says if this treatment does work, it will revolutionise varicose vein treatment. But he remains sceptical.
One of the features of the operation that as surgeons we've thought is very important is to do a proper tie of the broken vein valve in the groin. We think that if you don't do that properly, the veins may well recur in 3 to 5 years. Now, the venous technique obliterates the veins in the thigh, but it ignores the vein valve right up in the groin. And so you could expect excellent results in the early phase after using venous, but the anxiety is that there will be recurrence in 3 to 5 years because the vein valve at the top of the groin hasn't been tied properly.
We now actually have developed techniques such that we actually go back and we take all these tributaries in the groin, and so the objections they have really is the fact that they're not understanding what level we're at the moment. We really have developed it far more than people are thinking, and as they haven't come to see how I'm doing it. They really aren't speaking from a position of authority. I also have figures showing that it's 100% successful in those people that we close the vein. We've done 188. One of them failed to close, who is a 92-year-old lady, and of the other 187, every single vein that's been closed has stayed closed, and that's with follow-up almost to 2 years for the most now. And we've not seen a single vein going back because we don't open the vein. It's not tied. There's nothing, nowhere it can grow from. It's completely shrunk away.
The treatment is expensive, £3,000 for both legs, and is not available on the NHS. Jonathan Earnshaw believes much more research is needed before it could be extended across the country.
One can make arguments for all these technologies to be adopted once they have been shown to be effective. The NHS is littered with new techniques and new pieces of equipment that are brought in based on enthusiasm that turn